Okay, if you made it, I am Dr. Pearlman, a chiropractor from Dallas, Texas. If you're already familiar with the channel, welcome back. I made a short video to persuade people to watch this video because I believe it is incredibly important, especially with everything going on in the world, right? Make America healthy again. Understanding food and inflammation. Everyone's very nervous right now because of the economy. I mean, let's face it, there's no need to be beating around the bush or avoiding, topics that everyone's thinking about. In the next week or so, everyone's sort of kind of scared / anxious, nervous about which side they're on. I don't really think about that when it comes to like what my main priority is, because I am very focused, for those of you that know me, about patient outcomes and taking care of people. I give the gift of chiropractic because chiropractic saved me, and I don't say that lightly. There is no BS or exaggerative effect about how much chiropractic did for me. I could barely walk after a terrible CrossFit incident, despite having a lot of pre-existing bad issues with my lower back. The proverbial straw that broke the camel's back left me feeling like I was disabled for a while. When everyone told me not to use chiropractic and it couldn't help me with my herniated disc, chiropractic was the only thing. Dr. Doug D.Q. Bellis in Providence, Rhode Island, the only thing that D.Q. Bellis Family Chiropractic did, and I still owe him so much gratitude, so much thanks, was show me that chiropractic was the only thing that could have helped me at that time and got me almost 20 years to the point where I was stable, healthy, and nothing else could have helped. About a year ago, I did have lower back surgery for my inevitable stenosis and the amount of damage that was there. Now, I could decide that I could say I didn't have good chiropractic care in Texas while I was in school, or we practiced on each other too much, and that led to me needing a surgery. But during the recovery period, I learned a whole lot more, and I've been able to really do what I believe is a fine job taking care of a majority of my population of patients, and it's what gives me the greatest amount of satisfaction, and it's my purpose in life. So again, to circle back, when I say there's a lot of stuff going on as we head into these economic uncertain times, and the state of America, and sort of people that we love and people that we don't love and people that we argue with and people that are close to us, we really have to understand that there's a greater good. And that greater good is the people that are important to us, making sure that they know that we love them. The people that are important to us, making sure that they know that we're there for them. That people are not alone. Like, you are not alone. I know I'm not alone. And we have to be the best versions of ourselves. And the reason I say that is not to be a cliche, because there's a lot of bullshit out there. There's a lot of people selling you stuff. There's a lot of people saying, you're the product of the 5 people you hang around. Quit your job now. Get a side hustle. It's all about money. 10 things you can do tomorrow to be a millionaire. How to fix your sciatic and lower back pain. And guys, like, if you know me, a lot of that is just, it's clickbaity bullshit, okay? I'm gonna shoot straight with you right now. And the 4 topics we're covering today, remember, 4 topics, I promise you to stay on topic starting now, is this. Nutrition, AKA diet, your nutrition, and what that means to your health. Number 2, exercise and understanding what exercise even is and how it affects you. Number 3, sleep, rest, repair. What does it mean to get rest? What does it mean to sleep? What does it mean to be rest and repair? And number 4, and I'm going to try to do it as fast, not as fast as I can, but without boring you for an hour. Number 4 is chiropractic, and what chiropractic actually is and how it best benefits you and your family. So here we go. Hopefully no big interruptions from Dr. Axel or Matilda. So number 1, nutrition, and what does that mean? If I were to tell you right now that the number 1 reason you or somebody you love is feeling not well or sick, and you have gotten all the tests and you don't have cancer, you don't have colitis or Crohn's, like you haven't had a definitive diagnosis, which still doesn't mean that you can't get help through your diet, but you really are just feeling lousy. Numbness and tingling in the hands. Tingling or numbness, or your foot falling asleep. You're sleeping and you're waking up and your shoulders feel numb. You'll see where I'm kind of going with this whole numb thing. Consistent migraines, stomach pains, underlining gastritis or acid reflux, not the same thing, but one end or the other, where you're consistently uncomfortable or passing gas. If you're using the bathroom too much, constant urination, blurry vision, Okay, I'm not gonna go on with the list of symptoms, but so many symptoms are related to having a horrible diet. Now, what is a horrible diet? I will summarize it like this. If you are eating ultra-processed food or refined foods, okay, that means foods that come in a wrapper, foods that come in a package, foods you got out of a vending machine, foods you got from a vendor, things that were cooked or fried in oils, things that have added oils in them. Read your peanut butter jars, guys. A lot of you think you're getting peanut butter, but in actuality, you're getting peanut butter with canola oil, sunflower oil, all different kind of oils, added sugar, cane sugar, things like that are added oils and sugar together, fat and carbohydrate together. It's really bad for you. So what does that really mean, okay? It means that all the things that I just mentioned, you've got to get them out of your life because they are the culprits for oxidized cholesterol. Oxidized cholesterol is the problem. It's not just cholesterol, it's actually oxidized cholesterol. That's right, free radicals, bad things that are gonna bind to a necessary hormone, cholesterol, that's doing its job, but can't continue to transport fats and can't continue to do its job appropriately if we are the problem by making this hyper-inflamed, reactive, oxidized problem in our body that leads to constriction of blood vessels. Constriction, that's right. Say we've got a hole here and something's traveling through it, but it gets constricted and all of a sudden there's not so much oxygen carried on that blood. All of a sudden that nice pumping mechanism, that cardiovascular effect that keeps us alive and feeling our best starts to become constricted, but not just constricted, because high levels of sugar in your body, you thought I was gonna talk about insulin. Not even gonna mention insulin in this video. That high levels of blood sugar is a lot of it is because those constricted vessels are now transporting thickened blood, like honey thickened blood. It's breaking down the microvascular. Diabetes is a microvascular disease. It's actually hurting the blood vessels in your body. It's hurting the blood in your body, turning it thick, beginning to thicken, and the word I want to say is plaque, because everyone thinks about plaquing as this cholesterol issue. Think of it as a high blood sugar, thickened blood vessel, small arterial or venous wall from constriction, high blood pressure type of problems that is actually breaking down, deteriorating the vessel, hurting your body beyond repair, giving you cardiovascular disease, pre-diabetes, diabetes, and making it to the point that eventually there will not be a coming back from. So you have to be aware that you are killing yourself slowly, eating ultra-processed and processed foods, thickening the sugar, constricting the blood vessels, oxidizing the cholesterol, and leading to disease. You are killing yourself if this is the way that you eat. And I just made a video about things you can do to change it, but I will try my best to address it on another video. Okay, that's number one. We just addressed diet and nutrition. Number two, exercise and what that means to you. What is exercise? How does it actually work? What is it doing for you? So I can tell you right now, the exercise portion, here's the deal. If you don't do purposeful or intentional exercise, meaning if you're not trying to elevate your heart rate, if you're not trying to pump up the muscle, if you're not trying to get to a certain number of push-ups, if you're not purposely potentially jogging or running with a stride or striking your foot with a purpose, you're not really doing enough to build something, to attempt to do something in the body called hormesis, or at least what I would call intentional hormesis. Hormesis is the act of adding stress or adding let's just call it an insult to the body that challenges the body to be resilient, okay? So what you want to do is understand that exercise is actually an inflammatory process, okay? When you eat something that doesn't agree with you, it's a tremendously inflammatory process. If you exercise hard or you lift some weights and break down fibers in your body, it's very inflammatory. That's why it's painful to recover when you go a little bit too hard. It's very painful to recover. And that process of hormesis to build tissue resilience is how you actually become adapted or build adaptation to many types of insults, whether it's holding your breath underwater for a long time, whether it's walking or running at a vigorous pace, whether it's taking a medication that wasn't or is not good for you, so you take a lower dose, so you build a tolerance to it to where it's effective for you, depending on what that is. Could be supplements or supplemental, I was going to say. But that's what I want you to understand about hormesis. And when you exercise, you have to do it with intent. There needs to be like sort of an end goal. And that end goal should be to be a little bit better. Now, if I say be a little bit better, that's really a cliche. But if I said be a little bit more resilient or become better adapted so you could handle a bigger load, or you could handle more volume, or you can handle a faster pace in anything you're doing in life as pertaining to your exercise so your body can adapt and become stronger, that's what exercise is for. And I didn't even touch on the neurologic effect, but guys, when I tell you about the neurologic effect, the science that involves the, not dopamine, but more of that serotonin, the contentment hormone, right? The content feeling. There's another word I want to use about what's higher in the morning. Oh my God, I wish I could think of it right now. And the brain-derived neurotrophic factor, I believe, is what I'm going after, and how that good feeling and those endorphins that are pain modulators and give you that good feeling. Like right now, I feel like I'm being productive. I feel like I'm doing something that's actually making me think more clearly. It's making me have a little bit more energy. That's the effect that you want from your exercise, okay, guys? That is the goal. And of course, you never want to go beyond such a hard like pace and so much intensity that it gets you injured, okay? My rule number one always is going to be don't get injured, because if you get injured, lots of bad things happen, lots of slowdown, okay? All right, hold on one second here, guys. So we talked about, we're going to have now the third thing. So we've covered diet/nutrition. We've covered exercise and what it means and what it looks like and what does it mean in terms of your goals for exercise. And now we say a third, rest and repair. This is something that is so beyond misunderstood. It drives me crazy. When we talk about rest and repair, and we talk about sleep, we are not talking about getting 8 hours of sleep because you read somewhere, oh yeah, I heard you're supposed to get 8 hours of sleep. Oh, I'm well rested, I got 9 hours of sleep. Oh, I'm exhausted, I got too much sleep. Oh, I was up all night, 1 in the morning, whatever. I only got 4 hours of sleep. There's a great video on MedCram. I believe it's called MedCram University or just MedCram. It's on YouTube. It's about sleep efficiency. I believe the data is pretty clear that sleep efficiency, so how well you sleep and the level of rapid eye movement or not rapid eye movement sleep in terms of, again, how well you are sleeping and restful sleep you are getting, that is going to outweigh 8-9 hours of sleep any day of the week. Some people say I do best with 6. I only need 5. Everybody's different. It probably goes more along with the results probably fall in line more with when was the last time you drank caffeine? How much food did you have before you went to bed? Did you drink alcohol? Is there already a pre-existing issue that would make you not have a lot of sleep? Do you have anxiety? How much stress is in your life? I know people who have had tremendous amount of stress just in the last few months alone, stuff that we should hope we never have to deal with. But because of outside factors, people had to deal with these stresses and they were not able to sleep. Those are real worries. What are you going to do? Counsel them and say, don't worry about it. Oh, you got to take it in stride and all. How about this? Until you've dealt with some stuff that some people are dealing with, and we all have things we deal with. So therefore, don't judge. Let's understand that we all have our problems. We all have stuff we deal with. But the important thing to remember is, circling back to what I'm saying, is rest. What type of rest efficiency are you getting? But what's it also doing for you? Is it resetting you? Is it rest and repairing you? Aha, let's talk about that. Rest and repair, because that's the goal of sleep. You will never rebuild tissue. You will never synthesize or repair an injured tendon, ligament, disc, muscle if you do not actually have restful sleep. Rest is the only time you'll actually really begin to repair damaged tissue, and it's also the only place that you actually burn fat. That's right. You burn fat while you're sleeping. You don't burn fat while you're exercising. You burn sugar while you're exercising. You might make some ketones while you're exercising. You might go into your glycogen storage while you're exercising. You might sweat out tons of toxic waste and a ton of byproducts within the fluids of our body and lose tons of sodium, peeing more, exercising more, sweating more. You do not burn body fat until you are at rest. The better quality sleep you get, the better adapted you're going to be in life. And all I will say to end this point number 3 on sleep is you have to begin to make good decisions. Oh my God, eating proper diet. getting things done in terms of not just in life for your job or to feel productive, but actually exercise, in that intentional exercise for all the reasons we discussed. So when your nutrition's in check, when your exercise is in check, and then you feel like you're getting stuff done, you get a good healthy habit, a good routine, and you get good restful sleep. You get up early, you go be productive again. Okay, so those are the three things that we talked about earlier, but the fourth and final one is understanding chiropractic. Now I know, imagine a chiropractor telling you about chiropractic, chiropractor telling you what to understand about chiropractic. But here's the deal, guys. I am going to not sugarcoat anything. I'm not going to bullshit you. I'm going to just shoot straight like I always do. Chiropractic is one of the greatest interventions that you can get in terms of not just pain management, but potentially even better function based off just about any symptom that you're suffering with. And I say it because it's like this. There is no greater accessible, inexpensive, and potentially effective access point and treatment for something that you can feel related to your pain or symptom that could potentially give you a great outcome. And again, very inexpensive, very accessible. You don't have to dabble around and deal with insurance because they don't reimburse us chiropractors near anything anyways. Why most of us don't dabble in insurance, because we're just, again, everything that I said, affordable, accessible, right? And it's a short trial of care where the nervous system effects are so powerful and so profound, that you begin to feel better a lot of the times right away. Now, remember what I just said though. Like when I said possible and should and could, probable, whatever. If you have an injury to where you tore an ankle, if you ripped up your knee, if you blew out your back, if you can't turn your head because you got in a car accident, you have whiplash, and you got a bad disc and stenosis, and there's all these different diagnoses out there, you've got to give yourself time to heal. That's a totally different thing. Well, you think you go to your orthopedic doctor, they give you an injection, tell you to go to physical therapy for 3 weeks, 6 weeks, a month. You think that that's any different than going to a chiropractor when you blow out your back? You think that you should just be better when he pops you on your side, lay left, lay right, and all this BS? No, of course not. The best chiropractors in the world, and I'm not saying I am, I'm saying the best chiropractors in the world, where you hope you're in front of a great chiropractor who could, we want you to say, oh, he's the best, she's the best, they're the best. That's what we want. And understanding that the outcomes are only as good as your intention, your efforts, and what you understanding what you're going to the chiropractor for. And those really devastating injuries, they can be problematic. They can take time to heal. Hey, it takes a grade 1 sprain, not even of the ankle, but so think of a larger joint, your knee, your lower back, your shoulder sprain, grade 1, the lowest possible definitive diagnosis of a sprain, grade 1, and it takes about 2 weeks to fully heal. About, maybe more, maybe less, everyone's different, case by case dependent. What if it's a grade 2, grade 3? You're looking at months, but your chiropractor is supposed to get you better with two pops, 2 cracks. You know what I'm saying? No, it's not the way it works. But I'm not going to carry on about that. I want you to understand, in synopsis, chiropractic for pain is a spinal manipulative therapy to a region that reduces the symptoms through neurologic stimulation. It's brain to body, body back to brain, reduction in pain receptors, those are called nociceptors, stimulation of mechanoreceptors, those are mechanical in nature receptors. They're deep packed within the ligaments, within the disc, within the fibers of the tissue, surrounding tissue, and gives you that neurologic response. They have studies back in the day to show that you can reach, certain types of endorphins, pain modulators, that could last months. I find that in younger people. I find in the older population, maybe days, But the thing is, it's all about that desensitization of tissue and then adding back in active exercise, more like a physical therapy or an exercise trainer sort of based modality, a kinesiologist kind of modality to build stability. If you watch any of my videos, and I'm not going to get into it here, there's a big, fluctuation or this process within that spectrum of getting hurt, or that spectrum of injury, or that spectrum of disease, and that is you start with the passive, you end with the active. And going from completely dependent on somebody passive type of manipulation to going completely active, weight-bearing motion, completely different animal. So you got to understand that's what chiropractic is. Chiropractic is not going there, getting popped, I didn't get better in one adjustment, it didn't work. Chiropractic is not, I fixed your disease through a powerful adjustment to your atlas, we fix disease. No, we don't fix disease. We are a component of health, a non-drug, right? A non-drug given, holistic, so to speak, approach to a natural by hand means through the spine to the body, body back to brain, healing, or brain back to body, healing mechanism, because your body is smart. Your body is self-healing, self-regulating, should you give it all the good stuff. You add the bad stuff, that's when potentially a lot of bad things can happen, and you just wanna absolutely give your body the best chance to have the best life possible. And those 4 things that I just mentioned, diet/nutrition, exercise with intent, understanding sleep, and understanding what chiropractic is and what it isn't, if you've got a good handle on those things, I believe the rest of everything around you can fall into the right places and you should be doing pretty good. Is this for everybody? Is it going to pertain to everyone in all the same manner? Absolutely not. There's always outliers. There just always is. You know, is it going to be something that every single person here could watch and say, I had the exact list and it didn't work, you know, or I had the exact list and checked all the boxes and it did work. He's right. He's wrong. I don't know. But what I can tell you is I'm making this video because of a lot of experience, both in my personal life and a lot of experience because of what I've seen with my patients, 4.5 years into practice, what I've seen, and what I've seen observed, not only when I was a patient, even prior to becoming to a chiropractor, but seeing like some results, I hate saying that, but seeing outcomes, not just with chiropractic, but the people who did it the right way in terms of everything else we just talked about, you know, leading up to this point. Now, in closing, should you never eat a piece of cake in your life? I'm not saying that. I think we all can get into the point where we're eating a piece of cake once in a while. Should we never drink alcohol? I think we all know that we can consume some alcohol once in a while with no bad, repercussion. Do I think that you should be consuming alcohol as often as most of us do here in the developed world? No, I think it's way too much. I think it's far too much alcohol consumption. Not to mention what we do consuming caffeine that we don't consider a drug, but it is. What we do when we talk about smoking, anything, whether it's a cigar, whether it's, something that's less legal or whether it's cigarettes. We know that it's really bad for you. You know what I mean? Vaping, all that, like it's terrible for us. But some of us do. If we do it a lot, is it bad? Probably yes, probably very bad. If we do it a little bit here and there, is it going to be detrimental? Well, I don't know. Is it taking away from you being productive? And I could go on, but I'm not telling you you have to be perfect, because there's no such thing as perfect. But I want you to be aware of the realities of making these poor choices again and again and again, because a lot of the things we talked about in the beginning, especially with the diet and exercise, the easy, accessible fast food and the stuff out of the vending machines and the pre-processed stuff that's hyper palatable, as they say, tastes so good and you want more, and it's made for you to eat. It's made for you to be addictive, and it's made to keep you sick, okay? And you not doing intentional exercise, you can say, well, I walked 1,000 steps. If there was no increased heart rate behind it and you didn't burn any of the calories and you didn't feel like you were toning your muscles or challenging via hormesis, then you didn't do anything, okay? Honestly. And I don't want to hear about, well, it's better than nothing. No, sometimes it's not. Trading one vice because one is less bad doesn't mean that less bad is making you productive or is making you more healthy. It means that it's just potentially wasting time while you're supposed to be doing something that you know is going to be better, that's going to make you happier, that's going to make you feel more productive, that's going to make you potentially not just live longer, but more productive. We're not about living longer here when I say that. It's about being productive, feeling good, feeling healthy, and knowing it's the right thing. And the right thing is by being good to you and being good, and therefore the people that love you and you love them. It's really that simple. And I think the sleep, you know what I mean? Believe me, you stay up swiping on the phone all night, getting migraines, getting headaches, feeling nauseous, it's all related. Trust me. Get Sleep. Prioritize getting to bed. Get that pitch dark room with that cool air and get to sleep. You know, chiropractic. That's how we're going to close this. Understand what it is. Understand how it's going to benefit you. Don't shy away. Find a good chiropractor. Chiropractors are there for you. They're actually one of the few people out there that probably go into what they do because they really, really care. I'm not saying other providers don't care. I'm saying that chiropractors, by and large, really care. Find the one that resonates with you so you can get the care you deserve, so the loved ones, you and your loved ones can get the care you deserve. And with that, guys, in closing, and look at that, I kept it under a half an hour. A very informative video that I'm very proud of in one take with, I think, Axel interrupted once. And, please comment below, share the video, like, subscribe, all the good stuff. It'll only help me and keep me motivated moving forward. Anything you need, guys. Until the next time, this is Dr. Pearlman.